late afternoon and welcome to Rooted in Wellness, Exploring Health Policies for Black Women. I am Dr. Nicole Carter, the Executive Director and founder of HUES Women's Health Advocacy Institute, and I am excited to welcome you to our online roundtable where we will explore health policies as they relate and impact Black women. HUES Women's Health Advocacy Institute is an organization that cares for the women of color of every hue in our community. We have several strategies of care, including community and conversations, access and advocacy, and educational awareness. This particular event focuses on those three areas. We also focus on the R, research and resources. But today, this event fulfills our community and conversation strategies, access and advocacy strategies, and educational awareness strategies.
My name is Destiny Cole-Powell. I'm delighted to introduce myself as the Health Equity and Health Promotion Intern at HUES Women Advocacy Institute. I am a senior at Bowling Green State University, majoring in public health with a concentration in health promotions. And I'm just so happy to be here with you all today in hopes to promote health equity and empowerment for women.
Thank you. A person that we're introducing to you today is Dr. Carmela G. Daniels, and she will be presenting the mental health perspective for us today as it relates to policy. Destiny? You're muted.
Sorry about that. Dr. Daniels is a licensed clinical social worker in Ohio with a doctorate in social work from Capella University. She has received her master's of social work from Florida International University, a bachelor's in social work from Capital University, an associate degree in mental health from Sinclair Community College. She serves veterans and their families at the Department of Veteran Affairs. She owns Dr. Carmela Daniels Mentoring and Counseling, LLC, and educates in higher education. Recognized for leadership and service, she actively contributes to various community organizations promoting inclusive and support.
Our next presenter is Alicia Jackson, Dr. Alicia Jackson, and she will be presenting the physician's perspective today.
All right, so Dr. Jackson, she is the CEO of Why Health Matters. She is a proven leader in empowering women to improve their health of their families and communities. She is an advocate for health equity. Dr. Jackson is fighting for all people to have the opportunity to be healthy, regardless of race, ethnicity, gender, income, or any other attributes. Dr. Jackson has received her undergraduate degrees in music and biology at Case Western Reserve University in Cleveland, Ohio, and earned her medical degree at Wright State University School of Medicine in Dayton, Ohio, where she was a National Health Scholar. Dr. Jackson serves on the National Board of the Local Entitative Support Corporation and previously served on several esteemed boards.
Thank you. And our next panelist is Dr. Kimberly Freeman. She will be presenting the public health perspective today.
So Dr. Freeman voiced over 20 years of diverse public health experience, spanning nonprofits, local government, and managed care within a local health department. Her role as a public health executive underscores her commitment to health promotion, diverse prevention, and equity. Armed with degrees from Tennessee State University and George Washington University and the University of Illinois at Chicago. She is a master's certified health education specialist and a certified prevention consultant dedicated to fostering healthy lifestyles in individuals, families, and communities.
And then we have Robin Blair Atkinson, and she will be presenting the health policy perspective today.
So Robin Blair Atkinson is a health policy analyst at the Health Policy Institute of Ohio, where she focuses on qualitative research for the development of policy briefs and resources. Prior to joining HPIO, Robin worked at the Ohio State University College of Public Health, where her focus was facilitation of strategic plans, community health improvement plans, health equity programming, and supervision of the COVID-19 contact tracing team. She holds a master's of public health and a bachelor's specialized studies with a specialization in nutrition, culinary arts, and food insecurity from Ohio University.
These are some general terms that we think you perhaps should understand before we move forward. And so the first is health equity, because we're exploring policies as tools to either promote health equity or tools that have been known for dismantling health equity. And so health equity for these purposes is the state in which everyone has a fair and just opportunity to be as healthy as possible. Health disparity is a type of health difference that is closely linked with social, economic, and/or environmental disadvantages. I usually often put historical as well, historical disadvantages as well. So social determinants of health are the conditions in which people are born, grow, live, work, and age that shape their health outcomes. The term intersectionality, while it might not be used here today, it is relevant. I don't know if it will be used, but if it is, now you have the definition, but it is important to know. So it is the interconnected structures and systems that create inequality and inequities among people and populations based on social categories of difference, such as race, class, gender, sexuality, age, list goes on, ability. And then we have political determinants of health, which are the policies, laws, and systems that shape the distribution of power, resources, and opportunities that affect health outcomes. So these are a few, certainly not all of the terms that are important to understand and know while digesting the information presented today. So next, I'm going to actually briefly share a slide, but let Robin Blair Atkinson get ready for her presentation. And so our first presenter today is Robin Blair Jackson, who is a health policy analyst with the Health Policy Institute of Ohio. She is presenting first to kind of set us up for what we will be discussing today. She will tell us about the recent work done by the Health Policy Institute of Ohio. She will talk to us about who is involved in curating and enacting policy and how connected those folks are and involved with Black women, their families, and their communities. She will address what role, if any, equity plays in the creation and enactment of policy. And she will demonstrate to us and with us how we can track policies and their outcomes specific to those impacting Ohio, the greater Dayton area, and Black women.
Hi, everybody. Once again, I'm Robin Blair Atkinson from the Health Policy Institute of Ohio. It is a pleasure to be here with you. The Health Policy Institute of Ohio is a nonprofit, nonpartisan research institute, and our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. I know that's a mouthful. We are philanthropically funded. Here's our core funders. Don't need to go through this. What I do want to focus on to begin with is looking at what we think about health. When we think about health, many times we think about tobacco, we think about eating healthy, we think about, getting outside and getting some exercise in. But I want you to focus on this pie chart because health is so much bigger than just what you're able to do. And Dr. Carter spoke about social determinants of health. And that's a huge part of this pie. So health behaviors is this small 30%. We also have clinical care, access to care. Then we also have the social determinants of health, which is the social, economic, and physical environment. So that's things such as like food security, having safe housing, education, and transportation. That makes up 50% of our health outcomes. And the other big thing I want to point out here is this part. The underlying drivers of all of this has to do with inequality. And that's part of the reason we're here today, is looking at things like racism, discrimination, ableism, toxic stress, as well as trauma and violence. So some of the items that the Health Policy Institute has produced, every other year we produce what's called the Health Value Dashboard. That's looking at Ohio as a whole. And I'm going to kind of come into a funnel today. I'm going to start with Ohio and then come down to Dayton. Right now, Ohio's not doing great. We are ranking 44 out of all of our states. 43 when it comes to population health, and 44 when it comes to healthcare spending. So we're not doing a great job. We have a lot of work we can do, and that is why policy is so important. And as we saw earlier, when we rank this pie here, it's the same pie. We're doing pretty good with access to care, but a lot of the other issues we're having, such as social and economic environment, our physical environment, which has to do with air quality, water quality, all of these things we need to get better in, and that's why policy is so important. The dashboard is a very large document, but what I want to focus on today has to do with equity profiles, and this is something that we are very proud of. We look at equity profiles, which means disparities that are affecting different groups higher than other groups, and we look at Black Ohioans, Hispanic Ohioans with disabilities, people with lower income, and those who identify as LGBTQ+. Now, as was mentioned before, there is intersectionality with all of these groups, but the data does not always show that. So today we're going to focus on Black Ohioans. I'm going to come back to that slide. So what I want you to look at here is specifically focused on Black Ohioans. There's concerns with food insecurity. This number 3.5 means our children, Black children, are 3.5 times more likely to experience food security than white children in Ohio. Having a zero vehicle household, which can be very hard for accessing jobs, education, all that. We are 3.5 times more likely to not have a car. We experience severe housing cost burden at 2.2 times more likely. And severe housing cost burden means that you are spending more than 30% of your income on housing. And that's something we'd like people to stay under 30%, as well as air pollution. We are 1.4 times more likely to experience higher rates of air pollution. So I know you're saying, well, how does this go into policy? So if you look here, housing policies that we've experienced over time, such as redlining, and current policies such as predatory lending, has led to neighborhood segregation, concentrated poverty, and disinvestment in communities, specifically communities of color, low-income communities and communities of color. This equals harmful conditions for people, such as food deserts, unstable housing, unsafe housing. And that leads to gaps in outcomes. You can't tell somebody to get out and take a walk if their neighborhood is not safe for them to get out and take a walk. And then we wonder why communities may have higher rates of diabetes, higher rates of high blood pressure, higher rates of other chronic illnesses. This is why policy is so important, because we have to start at that policy place. And we have to stop putting the blame on individuals when a lot of what's going on has to do with our policies. Now, what I don't want is to leave you with absolutely no hope here. We are getting better. So if you look here, heart disease, Black Ohioans, we're seeing a 28% decrease in heart disease in Black Ohioans. Due to certain policies, such as the Affordable Care Act, some of the pandemic policies, we're seeing a decrease in those who are unable to see a doctor due to costs. So it's important that we fight to maintain these policies so that people have access to health care and access to what they need to maintain health. Another brief that HPIO has recently produced is we like to call it unlocking. It's about unlocking Ohio's economic potential. So the one thing I want you to get from this slide is this is not just a moral issue, it's also an economic issue for Ohio. What our research found was that if Ohio could eliminate racial disparities, it could gain $79 billion in economic output every single year. It's a huge amount of money. Now we're going to get down to where you all live. We're going to look at Montgomery County, can't speak today, and Dayton specifically. We're just going to do one slide from this. Last year, this is a great resource. We produced the Behavioral Health Equity Roadmap Assessment in partnership with the McAdams Board. of Montgomery County, and this is a wonderful document. These will be in the chat, all the documents that I spoke about. My colleague is here putting them in the chat. But what I want you to look at is this one slide. This is a life expectancy of those in Montgomery County. And as you can see how a lot of this is concentrated in Dayton. So lower life expectancy right here. This is also the same map that you get for housing cost burden, as well as food insecurity. The map looks very similar. So if you think about where you live, you can kind of see that, what's going on in the areas that you live. Now we're going to get to this policy section, and we're going to talk about our legislators. One of the questions was, is equity part of policy? It should be. The answer is not always. Some of that has to do with representation, and some of it just has to do with, the policy climate. This slide that I put up was recently produced by my wonderful colleague, Edith, and it shows Black representation in our Ohio General Assembly since the 1800s. This is absolutely phenomenal. And as you can see right now in 2023, Black Ohioans, we are about 12% of the population, and we hold 14.3% of General Assembly seats. So that is getting better. That's a good thing. At one point, we had one person, of course, 1880s, you can understand why. But what I'd like to now focus on is how you can find your legislator. And give me 1 second. I need to come back here and try to get out of sharing mode. And then I want to just take just a minute to go to the website and show you how to find your legislator. Give me just 1 second here. Okay. Can you all see the legislator website? Someone let me know.
Yes, we can.
Perfect. Okay. This will take me just a minute, and I apologize that I've gone over. First thing you want to know is how to find your legislator. You want to go to this website right here, legislator.ohio.gov. Do not be afraid of it. It's not as hard. You want to put your address in right here, and it's going to tell you who are your legislators in your area. Do not be afraid. I tell everybody they work for you. Okay. These are our elected officials. You don't have to have a fancy title behind your name or anything to contact them. So you want to go there. Now, you've read something online. You want to read about what's going on in your area. You want to search legislation. So you want to click here on legislation, click search. We get this nice box. You can type in keywords here, or you can type in specific legislation. Right now, I'm going to type in House Bill 204. We're going to click right here. This is the Crown Act. I hope many of you are familiar with what the Crown Act is. This is regarding hair texture and protective styles, protecting us from discrimination at the job. When you're looking at this website, you just want to look right here to see where it is. This is still in Senate committee. If you want to track it, you can click this button right here. It'll take you to a page where you just sign your name in, and you can come back to it and see where it is. Now, let's say you want to know what this legislation is about. You want to click documents. And I always tell people to go to analysis as opposed to legislation, because that's a long one. And you want to click on the analysis, and you want to go right here. And this gives you a complete, clear synopsis of what the legislation is about. And we're going to come back here. And then you can always click on committee activity. And here we'll show you, there's nothing here yet, but here we'll show you any meetings that have happened and testimonies that have taken place. So that is a simple website to use. Be clear that you can contact your legislators. That's the easiest thing to do. Talk to them, schedule meetings. And don't be afraid. We have to empower each other. We have to empower ourselves. They have to hear from Black voices. our legislators need to hear from Black voices. They need to hear Black stories. So thank you so much. I appreciate your time.
So the next presenter is Dr. Kimberly Freeman, who serves as the Director of Health Promotions for Public Health Dayton Montgomery County. We've asked her to tell us what the role of policy is in public health, to address how public policies create, regulate, and maintain activities, opportunities, and environments that improve the lives of Black women, their families, and communities. And if she can, provide us some examples. And then how can public health and community health institutions in the greater Dayton area and beyond uh, develop new partnerships and strengthen others to raise awareness about the policies impacting the lives of Black women, similar to that which was or has been done by the National Health Policy Agenda for Black Women, which was created by Black Women's Health Imperative. And so that particular report is done or created annually and is the result of intentional partnerships with policymakers and other partners. And so I'm wondering, or we're wondering, if this can be similar, if something similar can be done here.
Thanks, Dr. Carter, for inviting me today to present. I'm very excited to be here. It's truly a pleasure to be able to speak with you all today. And as stated, I'm Dr. Kimberly Freeman, Director of Health Promotion with Public Health Dayton Montgomery County, or Public Health, or PHDMC that you'll hear me say quite often today. And today I'll be sharing information about the policies impacting Black women, but from a public health perspective or from a public health view. So in general, public health focuses on protecting and improving community health and well-being, but the emphasis is on prevention, and public health promotes and protects the health of people and the communities where they live, learn, work, and play, which you heard a little bit earlier. Those are some of the, or you recognize those as some of the social determinants of health. As such, it's no surprise that the mission of Public Health Dayton Montgomery County is to improve the quality of life for our community or in our community by achieving the goals of public health, prevention, promotion, and protection. So here we have the 10 essential public health services, and the core functions are assurance, assessment, and policy development. So in order to achieve optimal health for everyone, these essential services promote policies, services, and systems that support good health and aim to remove systemic and structural barriers, such as racism, poverty, gender discrimination, and other obstacles that impact health equity. And as you can see, health equity or equity is at the center. And this is fairly new. I would say probably about 4 or 5 years old that that equity has been included here. And basically, all people should have the opportunity to achieve good health. So what's the role of policy in public health? So first, let's start with the definition. So public health policies are the laws, regulations, decisions, or actions implemented in a community designed to promote wellness and ensure health goals are met. Now, policies can be formal legislation, but they can also be community outreach efforts, and policies can be at the national, state, local, or even organizational level. Why are public health policies important? Because public health policies act on research and find solutions to identified problems. Strategies are focused on prevention and interventions. It's also important to know that in order for priority populations to flourish, you must address not only physical health, but social, economic, and mental health and well-being also. And I know that some of our other presenters will touch on these as well. So here are a few of the PHDMC reports. First, we have the Community Health Assessment. And this is Montgomery County's, the Montgomery County's Community Health Assessment, or CHA as we call it, provides information on the community's past and current health status, factors contributing to health risk, poor health outcomes, disparities, needs in the community, and community resources available to improve health. We also have the Community Health Improvement Plan, or CHIP, and this is the second piece of a two-part health improvement planning process. The first one is the community health assessment that I just mentioned. Identified health concerns and needs within Montgomery County guided the selection of the priorities here, and as well as goals, objectives, and strategies that are the focus of this plan. And then we have the strategic plan, which advances public health's mission of improving the quality of life in our community by achieving the goals of public health, again, which are prevention, promotion, and protection. So another report that we have is the Public Health Policy and Advocacy Agenda. And since today's focus is on policies, I wanted to discuss this document. Community health assessment data is used to support evidence-based policy changes, specifically at the state and local level. At Public Health Dayton Montgomery County, we believe that health and equity considerations are key to decision-making on services and policies that impact public health. And here you see that our policy and advocacy agenda aligns with National Public Health Foundation areas: communicable disease control, chronic disease and injury prevention, environmental public health, maternal, child, and family health, and access to linkage with clinical care. I will mention that behavioral health is also mentioned in this agenda, as we support the Montgomery County's Alcohol, Drug Addiction, and Mental Health Services Board Community Plan. So how do public health policies improve the lives of Black women, their families, and their communities? They help to achieve better health outcomes, address health disparities, and promote social and economic equity. Black women have made health improvements over the years. However, health disparities still exist. And when compared to other women, Black women have higher rates of maternal mortality and have shorter life expectancies. We are disproportionately burdened by chronic diseases or chronic conditions, including obesity and cardiovascular disease. Economic and social equity are needed among Black women for health equity to be achieved. So let's take a look at some policy examples. I mentioned earlier that I'm the Director of Health Promotion, and in the previous slide, some National Public Health Foundation areas were mentioned. Chronic disease prevention and maternal child health are two of the shared topic items, and these are within the Office of Health Promotion. With that being said, there are several public health policies that apply to all people that will definitely contribute to improved health outcomes in Black women. So I'll share some policy examples in these areas, as well as in other areas of public health. And all of these can impact Black women, their families, and the community. So looking at communicable disease and disease control. Public health is charged with controlling the spread of communicable diseases like the flu, COVID-19, and even sexually transmitted diseases like gonorrhea and HIV. Some policies focus on reducing vaccine preventable diseases. An example is with COVID-19. You know, there was a policy that we had to wear masks, or we had to stay 6 feet away from others in public areas. Also reducing sexually transmitted diseases. An example here is in some states, there's a policy where you have to be tested for syphilis before getting married. Next, we'll look at chronic disease prevention. So heart disease and cancer are the top 2 causes of death in Montgomery County. Tobacco use, poor diets, physical activity, and alcohol use are risk factors. Chronic disease policies focus on decreasing the use of nicotine products. So there are some policies now that include increasing tobacco prices and creating tobacco-free areas in communities. And this is aimed at protecting non-smokers from the effects of secondhand smoke. Then there's decreasing alcohol use. And a policy here is, you know, that you have to be 21 in order to consume and purchase alcohol. Next, environmental health. So public health is also charged with protecting against threats of food, water, and air. Example policies here include the temperature requirements for restaurant foods to make sure that foods are safe to eat. And then also the fluoridation of drinking water policy, which protects your teeth or protects oral health to make sure that you prevent cavities. And then last but not least, we have maternal and child health. Infant mortality is an indicator of the health of a community. And in Montgomery County, nearly 8 infants die for every 1,000 births. And there is a racial disparity, as Black babies die at a rate of almost 4 times higher than white babies. And so example policies in this space are childhood lead screening, testing, and reporting, and the Pump Act. And so this is focused on breastfeeding in the workplace, where nursing employees have the right to reasonable break time and a private place other than a bathroom to express milk during work hours. So how can Public Health Dayton Montgomery County and community organizations collaborate to raise policy awareness as it relates to Black women? These are in no specific order, but all are important and contribute to raising policy awareness. Communication supports policy as it provides a way for people in our community to learn about policies and services and how they can take action. Establishing or strengthening partnerships. This is important. It's important to partner across sectors, including healthcare organizations or providers, schools, work sites, and community organizations. Partnering helps to spread the message and allows for the sharing of resources. Trust is also important. This is the basis for everything that we do in public health. It's the foundation of relationships. Where there is trust, people will work together more effectively. And treating people with respect, being kind, and being honest or transparent can help to build trust. Then there are resources, and resources come in several forms: funding, volunteers, and even employees such as community health workers who are great at connecting clients to resources, and these contribute to policy awareness. And last but not least, again, are common goals. Having common goals are important in raising awareness as they allow for the implementation of a clear strategy with individuals or groups with similar attitudes, beliefs, behaviors about a topic or issue, in this case, policies impacting Black women. Working with a team focused on common goals contributes to program or policy success. Lastly, I want to mention a few of the Public Health Dayton Montgomery County programs where Black women are a priority population. Under chronic disease prevention, we have the Physical Activity Cooking Education, or PACE program. And the purpose of this program is to prevent cardiovascular disease and hypertension in African Americans. So it's not just for Black women, but Black women are included. This is a 6-week program that includes heart health education, physical fitness, nutrition, and cooking classes. Program participants must be over the age of 18 and cannot have hypertension, since it is focused on prevention. We also have the local Office of Minority Health, and this office receives funding from the Ohio Commission of Minority Health. And the purpose is to reduce health disparities and inequities in the health status of minority groups in Montgomery County. Again, this is not only for Black women, but Black women are a priority population here. We have several programs in the maternal and child health space. First, Moms and Babies First. This is a culturally connected home visiting program that promotes Black infant vitality. The goal is to achieve positive pregnancy outcomes and help ensure children thrive throughout the first year of life. We also have Queens Village Dayton, which addresses racial disparities in birth outcomes, specifically in Black mothers. And this organization provides a safe place for Black mothers to support and be supported by their peers, and just to connect with others and build a better life for themselves and their children. Next, we have the Ohio Equity Initiative and the Expecting Growth in Educating Mothers for Success. These two programs have different funding sources and have somewhat of a different structure, but both focus on reducing racial disparities, achieving equity in birth outcomes, decreasing infant mortality, and promoting infant vitality. And this is my last slide. Thank you so much.
Thank you. Our next panelist is Carmela Daniels, co-director of Region 7 National Association of Social Workers and the founder and CEO of Dr. Carmela Daniels and Associates. The questions she'll be addressing today are what the role of policy is in her work as a clinical social worker and a newly appointed co-director of Region 7 NASW. Also, how do current mental health policies address the unique needs and disparities faced by Black women? Then, what policy or policies shape her practice and the work she does for and with Black women? And finally, What future policies are
Is
needed to better promote
Dr.
the
Carter and
mental health
to
of
the
Black
HUES Organization Foundation for allowing me an opportunity to come here and speak today. To this esteemed panel of guests, women of color who are helping us understand the needs to meet for women in all phases of education, from policy to medical care. I'm Dr. Daniels. I am the president and CEO of Dr. Daniels Mentoring and Consulting. I also work for the Department of Veteran Affairs, and I've done that for almost 15 years this coming September. And so I have a variety of experience in working with women, providing care for women in the mental health and medical field. And so one of the first questions that I was asked was the role of the policy. What is the role of policy in the field of social work? And so when we're looking at the care for people of color, period, for women, men, BIPOC populations, what we start with is advocacy, right? We start with a space to advocate for those who are not able to do that for themselves. We look at what can positively impact individuals in their lives so that they live successfully, so that they have access, equitable access to their needs, to their care, to their mental health, and any other things that they may need. We make sure that we advocate and promote social justice, equality, and again, access to resources. Many times, the disparities in our community are connected because we don't have access to get to them. It could be bus, it could be food insecurities, medical insecurities. We look at things that happen in our communities that don't happen in other populations or communities, right? We look at things that happen as far as grocery stores closing, banks closing, mental health services stopping, or limited funding that we don't see in other spaces. So we advocate in those areas. The other part of that is the social ethical practice. As social workers, we adhere to a code of ethics, right? And so what that does is that we make sure that we commit to that. We want to make sure that we are in a space where we are promoting the well-being of all that we serve. We want to make sure that our policies and procedures of how we operate are fair, that they make sense, that they're understandable, and that we don't create barriers in our own spaces. Next slide, please. The question of what is the current mental health policies that are needed? So we know that there are barriers to mental health care, right? Considerable barriers for ethnic communities, right? And these things continue to embrace us because of how people view people of color, how they view what we go through, generational trauma, post-traumatic slave syndrome, other things that affect people of color that do not apply to other populations. And so because of that, many times we're put in positions as people of color, we need to explain constantly what we've been through, as opposed to the story being there and being believed, right? We need diverse representation. When we look at the field of social work and advocacy and medicine, it is imperative and important many times that we see someone on the other side of the screen that looks like us, including therapists, counselors, teachers. We want to make sure that we connect and have some type of cultural background with many of our providers. Those policies need to be reviewed and looked at in order to make sure that that happens. A term that we talked about at the beginning by Dr. Carter was intersectionality, right? They need to adapt that, the intersectional approach that acknowledges multiple identities and experiences that shape Black women's mental health, that shapes our community's health. What we know about women of color is that they are many times the breadwinner, they're single moms, they have many things that they are combating day to day. And with that, we know that there are things that come as a result. Next slide, please. What shapes the work that I do? As a clinical social worker, I am influenced primarily by the women that I work with, Dr. Carter, the panel, people who are also invested in making sure that women of color are given the services and care that they need. I dedicate that because that is a space that has been safe for me. And I want to create that space for others and continue to do that work. Linking women of color with the services that they need, being a support to them, being support to men of color as well, to young women, young girls. My daughter is 12. I always look for spaces that she can grow into and grow up in and also be safe. And so that shapes the work that I do, making sure that we understand what is needed and looking at people for who they are. It's not a cookie cutter type situation. Each person has their own intricate ideas, thoughts, and needs. Next slide, please. What future policies are needed to promote mental health for women of color? One of my colleagues and mentors, Dr. Speak Hall, always says we need to believe women of color. We need to start in their truth. The policies are going to be changed when we begin to start with the belief of women of color. What is it that they are saying about what their needs are, addressing that, looking at that, and meeting that need. We need culturally competent mental health services. We need people who are sitting in spaces that are able to meet our need. We no longer need spaces that where people think that they need to save us or other harmful behaviors that really add more to what it is that we're going through. We need to be able to be in spaces that hold our truth, allow us to be our authentic selves, and that is intentional. Intentional spaces, addressing harm in workplaces and other organizations, being strong in our community, looking for support for one another, presenting ourselves in spaces that, not saying that we're perfect or we have anything, but who we are when we walk in spaces is authentic, it is true, and it is identified with who we are. So that's what we want to do for when we're looking at policy. Policy is looking at how much money and funding is going to go here, but really it starts down with the core of where people's needs are and where those needs should be met. Next slide, please. So that's my contact information there. I thought there was another slide, I'm sorry. And I wanted to make sure that from this recap here, and I'll answer any questions that anyone may have as we move to the next speaker, but that the future of policy, when we're looking at social work policy, we're looking at care, we're looking at what is going to be done differently, we're looking at what should be done differently for women of color. We need to start with their truth. We need to start with making sure that we understand what that need is holistically. We need to start to make sure that we are creating culturally competent providers, meeting with those providers, ensuring that people have access to a provider that looks like them if that is their preference. Reducing those barriers that we see in our community, making sure that we understand this is a barrier here, or if people can't get to the doctor, or if a doctor is booked 4, 5, 6 months out, how can we look to support and get those services that we need? So thank you for the opportunity to present here regarding mental health and women of color. Thank you.
You're welcome. Our next presenter is Dr. Alicia Jackson, founder and CEO of Why Health Matters and president of the Lloyd H. Dean Institute for Human Kindness and Health Justice. The questions she will be addressing today are: can you tell us what you believe the role of policy is in your work as a physician, CEO, and as president of a health equity institute? Next, we know that policy can either exacerbate or mitigate health disparities. How has policy impacted the women, particularly Black women, you encounter in your practice? And finally, how have policies transformed structures and practices of care from your perspective as a physician, founder of a health equity organization, and president of a health equity institute?
Thank you, Nicole, and thank you, Destiny, for putting on such a wonderful event. Again, I'm so excited to be here with all of you today, and of course with my esteemed panelists. I love the different perspectives that you have brought together as it relates to health policy. As mentioned, I'm actually a physician. I'm a family medicine doc. I trained at Wright State. I actually trained in every single inpatient facility in Montgomery County, including the public health department, in the VA, and all the hospitals that were there at the time many, many years ago. So again, really, really excited to be with you all today to talk a little bit about how a physician can participate in some of the conversations around policy. So I'm going to, let's see if I have the same issue. Okay, is everyone able to see my screen?
Yes, we are. We got it.
All right. As mentioned, I am also the CEO of my own company, Why Health Matters, which I'll talk a little bit at the end. And in my day job, I'm the president of the Lloyd H. Dean Institute for Human Kindness and Health Justice, which is a part of Common Spirit Health. Common Spirit Health, we are one of the largest nonprofit healthcare delivery systems in the country. We are in 23 states, and we do the full continuum of care. So we have over 140 hospitals, over 900 outpatient care locations. So that's everything from primary care to assisted living facilities to home health. And like I said, virtual care, anything that you can think of, we are engaging in that type of care delivery. And so one of the things that we do in our practices within our organization is something that we call a reflection. And so this is the reflection that I would like to share with you all today, which is actually reflective of the gentleman who the institute that I'm leading is named after. So Lloyd Dean was the former CEO of Common Spirit Health. And he said this many years ago that someone had posed the question to him on a fireside chat, kind of like with what we're doing today. What's the most innovative thing you've seen in healthcare? And this is what he said, that the most innovative thing that I've seen in healthcare yet is a simple and proven idea that kindness has the power to heal. And I remember hearing that. I was in the audience at the time, and I wasn't working for him at the time, but I remember hearing that thinking, wow, that was such a powerful statement. And it just resonated with me personally, professionally, just in my own experiences as a caregiver, but also as someone who has received care, that the times that have stood out to me have been those times when I've been connected, right? I've been connected to the patient that I'm caring for. I've been connected to the individual caring for me. I felt that kindness, that compassion. I had trust in the provider, and really thinking about how powerful that is. And so I'm really excited to talk to you all today a little bit about that. And when I was thinking about policy, I often use the phrase big P policy and little p policy. And I think what you've heard from my previous presenters, a lot of them discuss some of the bigger P policy. So the things that are happening at the state level, at the federal level, those are the things I call kind of big P policies. The reality is there are things that are happening in every single organization that we are a part of that mitigate or exacerbate disparities in inequity, right? And so I'm going to talk to you a little bit today about little p policy, so things that we're doing and how we're thinking about it from a healthcare delivery system, some of the things that we can do differently to address some of the disparities that we see, specifically with Black women. So one of the other things that I realize is that a lot of times we don't know the disparities that are impacting our group, right? Our network, if you will. And so one of the things that I have also added is kind of this, what we call, did you know? And so did you know that Black women have higher allostatic load scores than others? And that's regardless of educational attainment. And I did put the link there for those of you who are kind of like the nerds like me who want to go and see the actual study. But allostatic load, if you're not familiar, is actually something that can be measured. They're markers in your blood. So you could go get a blood draw and have these things measured from out of your blood. And what they are, they're different hormones and chemicals that actually are a reflection of the stress that your body is under. So basically what this is saying is that of all the different groups, when you segment it by race, ethnicity, and gender, we as Black women have the higher blood levels of the manifestation of stress. And a lot of you are probably nodding your head like, yeah, that makes sense. Because, you know, we often hear that we have this like superwoman complex, right? That we're often taking care of so many people and we're, you know, holding it down at work and we're holding it down at school. But how often are we given the opportunity to take care of ourselves, right? And so the reason this is important is because when you have higher allostatic loads, you have higher risk for some of the things that has already been talked about, higher risk of cardiovascular disease, higher risk of depression, anxiety, easier to put on weight and harder to get it off, right? So I think it's critically important that we all understand this and know that there are more studies that are coming out about this and also now starting to look at, well, how do we reduce those loads? And I'll talk a little bit about that later. So at the Institute and at Common Spirit, we really believe that health justice starts with human kindness. And I will say we were intentional about using the phrase health justice instead of using the phrase health equity, because we wanted to get to that policy piece, right? So health justice for me, for us and for me, is really this notion of the combination or the intersectionality, if you will, of health equity and social justice. Because we now know, again, it's been shared multiple times throughout this presentation, that the things that are happening where we live, work, play, worship outside of our clinical care delivery system, those things are the things that are the more impactful on our health outcomes. So I can strive for clinical highly excellent evidence-based clinical quality of care within the system that I work in as a care provider. But at the end of the day, even if I get that 100% right, it's only going to impact your health about 20%. The other 80% of what impacts our health is actually happening outside of a hospital, right? Outside of the doctor's office. And so as a system, we're really saying, what's our role as a care provider, as a care delivery provider, in that social justice space, as well as the clinical health equity space. And we firmly believe that we can accelerate progress in both of those areas with the tenets of human kindness. So what do I mean when I say human kindness? Because honestly, it's kind of a made-up word that we created many, many years ago. And so what we mean is really looking at the science of kindness, compassion, empathy, and trust. So if you look at the data, and especially in the social science world, so again, I'm so glad I have, you know, social workers and policy people, because in public health, because they've been saying this for decades. That these things, specifically these 4 things, kindness, compassion, empathy, and trust, actually have significant impact on improved health outcomes. And so how can we actually leverage the science to accelerate improvements, as I said, in health equity and social justice? So at the Institute, we exist to kind of do 3 things. One is to educate around that science and make sure people are aware of it. The second is really amplify work that's happening. There's a lot of amazing work happening across our country as it relates to this work, and even specifically in Dayton. I'll give a couple of examples. And then, of course, how do we continue to support innovation in this space? And that's so critically important for a couple of reasons. One, we're at a time where we're the most digitally connected, but we're the most socially isolated. And you might be saying, okay, well, why is that important? As a matter of fact, the Surgeon General, the US Surgeon General, just put out a report last year that talked about social isolation and loneliness as an epidemic. And it's disproportionately impacting our seniors and our youth. And thinking about that again, well, why is that important? Well, social isolation and loneliness leads to higher rates of cardiovascular disease, higher rates of depression, anxiety, higher rates of suicidality. So there's all this connection that we, quite frankly, in the healthcare delivery system are just now starting to recognize and think about, well, how do we start to address some of these issues? So we're looking from the Institute standpoint in a couple of different areas. But I would like to just call out, going back to what my colleague mentioned earlier from the Policy Institute, the notion of economic mobility and stability. That's so critically important as it relates to health outcomes, and especially for Black women. So one of the things, when going back to the allostatic load, one of the factors that can kind of help with that is educational attainment. So the higher educational attainment that specifically a Black woman has, it does show a decrease in some of that allostatic load. Now, it doesn't get us to zero, and we're still higher. But again, we're thinking through what are some of the things that can be done outside of the care delivery system that can help improve health outcomes. So another big policy change that actually goes into effect this year, and this is a big P policy change. So CMS, which is kind of the federal regulatory body, if you will, for Medicare and Medicaid, actually made it put a requirement in place for all hospitals to now screen for social drivers of health or social determinants of health. So you've heard this mentioned multiple times. So if you are actually admitted into a hospital, so not if you go into the ER necessarily, but if you are actually admitted into the hospital, you will have questions posed to you about your social determinants of health or your social drivers. And that's important because, one, we're now saying, okay, we need to collect that information. We need to know what's going on with you. We also will have resources available. Let's say you do say, I'm having difficulty getting food. Well, it's going to be on us as a provider to help connect you to community resources. So this is a huge shift in healthcare delivery. I'm really curious to see what's going to come from this. We're going to have a huge amount of data around social drivers that we didn't necessarily have from a real-time standpoint. Our public health departments have been doing a great job of collecting this data from kind of a community level standpoint. And so it's taken us a while to get on board with the work that they've been doing, but we're there now, and it is a requirement. So I think it's good for you all to be aware that this is happening because it's a shift in care. And you might be like, wait a minute, you didn't ask me this a year ago or 2 years ago. What's going on? Why are you asking me this? Well, this is the reason why. And so for us, we're really being thoughtful too about making sure that the people we're caring for understand why we're asking, right? And so our campaign is really around we ask because we care. And we really kind of go into why this is important, what we're going to do with the information, which is we will only be sharing this information with community organizations if you allow that, if you want that to happen. But I think it's really important for us to make sure we're empowering those individuals who are coming to us for care with the right information about the things that they are receiving. And quite frankly, that's been something, especially as Black women, that we haven't often gotten, right? And so I just, again, wanted to make sure you all were aware of that. I think the other thing to think about are, well, what are some of the initiatives, programs that are going on right now that really are focused on trying to improve some of the disparities that we see? So you all may be aware that Wright State and Premier have now partnered to bring to really create this academic medical center. within Dayton, Ohio. I think that's significantly important. Again, as someone who trained there, there's such a unique opportunity to really engage more of us into becoming care providers. And I mean that really in the broad sense, whether we're talking about nurses, our social workers, our physicians, our, respiratory therapists. We need more Black people and Black women and all of that. Administrators, we need more of us in those roles, because once we're in those roles, we have the opportunity to address some of those little p policies, right? The policies that are happening within organizations. The other thing that Premier has invested in is the mobile clinics. So they do now have these mobile units that are going to communities of need and actually taking care there. I think that's been one of the other things we've been struggling with from a healthcare delivery system in general, is that we've always expected people to come to us, right? And the reality is, I think Dr. Freeman mentioned it, sometimes it's transportation is a barrier, right? So how can we start to get out more in our communities? Clearly, we can leverage telehealth and virtual care. We saw that with COVID because we had to make that transition. So I'm really hoping that we can leverage technology to reach more people, but we do also have to make sure that we're not unintentionally causing more disparity because of the digital divide. And then the last thing I would say about this is we're excited. We just partnered with Morehouse School of Medicine to specifically increase the number of underrepresented minorities, and again, especially in the Black community. Physicians and advanced nurse practitioners or advanced practice providers. So we're bringing forth 5 new regional medical campuses across the country so that we can help double the size of the classes at Morehouse School of Medicine. So again, just really thinking about different partnerships to do this work. And then the last thing I would say, as Black women, we have to learn how to be kind to ourselves. I think we oftentimes, again, as I said, we have this superwoman complex. We're doing so much for others, whether it's our children, our families, our work. But the reality is we need to rest and we need to restore. And so in my company, which is Why Health Matters, and I did put the link there, you can go and check out some of the recommendations in that. I also, maternal health, infant mortality, birth outcomes in this country, it's just really sad that we are where we are. And quite frankly, we need to start advocating for ourselves as Black women and Black birthing people to hold us, and I mean health systems, legislation, everything accountable for these health outcomes that we see as it relates to birth. So I did also put a link there for a recently published book, The Practical Playbook, that is specifically looking at things that work, things that actually do improve health disparities that we see as it relates to birth outcomes in this country. And then ultimately, I would just say real change requires strong collaboration and engaged partnership. I gave you some examples of that and what we're thinking about from a large healthcare system. Couldn't do it without public health and policy and behavioral health. We all have to work together. And I'm hoping that I have met some new friends today that we can continue the conversation. So thank you again, Dr. Carter and Destiny and your organization for having me.
So the question was, how can understanding and helping to shape policy empower Black women seeking and needing care to better advocate for themselves in healthcare settings?
The shaping of policy, how, first of all, the advocacy, I talked about that a little bit earlier. Understanding how policies work. When we're looking at how we vote, when we're looking at how we sit ourselves in spaces to make ourselves aware of what is going on, I will be the first to own it. I haven't always been aware of who is in my state, local offices, who's standing in rooms speaking for me, speaking for my health. When Roe versus Wade was turned over. We were all over that, right? We were all over that. Everyone's looking, everybody's woke, everybody's doing. That's the same thing we have to do every single day regarding every aspect of Black women's care. Our babies are dying. Our mothers are dying in maternal rooms. They don't have resources. They don't have support. We don't have enough social workers, clinical providers who are woke enough and invested in us living, period. They don't care. And so when we're looking at that, we have to be invested in what's going on with us and finding out who is making the changes that's going to affect my daughter when she goes to the hospital, or when my mother, when she needs mental health services, or when my sister get ready to have a baby. So hopefully that answers your question.
It does. Thank you. Would anyone else like to speak on that?
I would. One of the things I want to thank you so much, Dr. Daniels. That was really powerful. But I want to add to that, if I can. One of the things that I think we look at a lot is we look at the federal level. We look at the president. When we're looking at shaping and understanding policy, we have to look at our state and local governments. Black women, you have to know what's going on, because your state and local government are going to impact you, if not as much as more than the federal government. You know, yes, you see things at the federal government, but what's going on with funding for maternal and infant health here at the state level? What's going on in your specific county? What's going on in your city? We have to be involved. And that's what I was saying earlier. They have to see our faces. They have to hear our stories. They have to hear our voices. And it needs to be at this level. And honestly, it's a little easier to reach out to our legislators here at this level than it is, you know, to get to President Biden. It's a lot easier to say, you know, Congresswoman or Senator here, here's what's important to me. And you work for me. You work, you know, I'm one of your people. I'm one of your constituents.
Now, and I would just add, thank you, Robin and Carmela. I think I would just add to, in addition to, you know, thinking again about the little p policy and even organizational change, how many of us have received the patient experience surveys after an encounter with the provider in our email, or maybe in a text message, or, you know, in some cases still the mail, and we just delete it or we ignore it, right? Even if we had a bad experience. And so I think it's important for us, again, we have to get more comfortable with advocating for ourselves and being honest about our care experiences, because I guarantee you those things are looked at. We are held accountable from a finance standpoint on what our patient experience scores are. So if you've had a bad experience, and if you had a good experience, so we also like to hear when you've had amazing experiences, but definitely if you've had a challenging experience with a provider, fill out that form. It takes usually 3 to 5 minutes, but it can actually be something that can then be leveraged to hold a provider accountable.
And I'll
go ahead.
Back off of what everyone was saying. I think it's important that we have, or that we gain more knowledge and awareness of racial disparities and health-related inequities. And like Dr. Jackson was saying, don't be afraid or be dissuaded because of poor treatment that you've had in the past, or treatment that you know that Black people have experienced in the past. We have to stand up, and we do deserve, we know we're worth it, and we do deserve optimal health. So I think that's one thing that we need to take a look at and see what we need to do to get the great medical care that we are so deserving of.
Okay, thank you, Dr. Jackson, Dr. Freeman, Dr. Daniels, and Robin. I really appreciate that. Moving on to the next question. What strategies can be used to involve Black women in the policymaking process, locally, statewide, and nationally? And anyone can chime in.
I'll start with that one. I think we have some national organizations that we can tap into. So I'm thinking of American Heart Association, American Cancer Society, American Lung Association, and those are just to name a few. But most of those national organizations also have local chapters that we can tap into. I, for one, know that with the American Heart Association here in Dayton, they have a HBCU Scholars Program, which really focuses on helping students at historically Black colleges and universities explore paths in medicine, career paths in medicine or medical research. They also have a STEM program, or STEM Goes Red program, which is really focused on young girls and having them explore science, technology, engineering, and math. I also have to talk about the local and state health departments. I'm coming from a local health department. That is a great resource here. And I also have to shout out Robin with the Health Policy Institute of Ohio. I've used that health value dashboard, that data, on several occasions, and it is wonderful. I do keep up with the new editions of that dashboard. So thank you for that. And I think that's a great resource for us as well.
I'm not a panelist. I'm just the the person facilitating the conversation. But I also want to just add that several of us here today on this panel are part of organizations that work and do advocacy work. And so that's another way to engage as well. So many of us are part of sororities that do this work consistently. Shout out to Delta Sigma Theta Sorority Incorporated. And then and Sigma Gamma Rho for Dr. Daniels. Okay, but also the NASW does policy work as well. So I just wanted to chime in. There are some other organizations that are not always associated with policy work that do that work in our ways and avenues for folks to, or Black women to get involved in advocacy.
Finally, if you could enact a health equity policy that does not exist, that would transform the lives of Black women for the better, what would it be? Don't all speak at once.
You're saying a policy that does not exist?
Does not exist, that would transform the lives of Black women. And I will put it in the chat below too.
I would create, I'm gonna make up a policy. I'm gonna make it up. I would create the women of color, African American policy of inclusion and acceptance in both hair, body shape, image, education, status, financial. Because I think that when we look at women of color, we have to look at the crown of her head to the sole of her feet and every other thing that incorporates who she is as a woman. And so I'm making that up, but I like that policy already. And so, because I think that it incorporates the space that women of color need to be safe, not that other populations don't. But we see in the news, when we see the Dr. Baileys of the world who have committed suicide from bullying and other harmful behaviors from organizations, when we see our young Black men going to court because of their hair, right? Because Texas, well, y'all got enough time to take a child to court? I'm not sure what we're doing with that. When we're looking at everything of people of color, we got to touch from the top of their head to the soles of their feet, because it all incorporates what we carry. And so that is a policy that I would incorporate and that I would do.
I love that. That was great. Does anyone else have anything to share?
I can go. There's a program, it's the All of Us research program. And so that's something I've been kind of exploring recently. And so I was thinking about a policy that would encourage or incentivize Black women to participate in research programs such as that. They look at collecting data from diverse populations. And we know that as Black women, we are very much underrepresented when it comes to biomedical research. So if we can get our information out there, that would be great. It is a process. But it's fairly simple, and you don't have to answer every question that is there, but whatever we can do to get our data so that we can have information about us. And it may assist us with approaches to care, as well as identifying opportunities to address just health disparities or reduce disparities. I'll put the website in the chat for everyone too.
Okay, thank you.
I love that, Dr. Freeman. I think I will add, which some of you may say, why is a physician saying this, but I think universal childcare. I think, we have to really understand that pipeline. I see Coach Powell's on the call here, so he definitely understands that education is really a key for us. And we know that our children are not prepared for kindergarten when they're entering. A large percentage of them are not. And if they're not prepared at kindergarten, they're not proficient at reading and math at third grade. And if they're not proficient at reading and math by third grade, they're already down a path of poor health outcomes, potential interaction with the criminal justice system, et cetera. So I would say, if I could wave a magic wand, implementing universal childcare from birth until starting kindergarten, so that our children really are coming into a system ready and prepared.
I guess I'll give the final word on this one. Okay, I'm gonna kind of go off script a little bit. When I think about policy, one of the things I always remember is we are a community, but we're not a monolith. So we don't all have the same issues, the same, the same concerns, but we have that same baseline. And one of the things that I think everyone has talked about is understanding systemic and institutional racism when it comes to the history of this country and the history of policy. And I would like to see policy, and I don't know if it will ever happen, but I want to see policy that says that has to be addressed when policy is written. That we have to look at the baseline of what systemic racism has done and what it continues to do in every arena. There are still doctors who believe that Black people don't experience pain at the same level. Mental health, our criminal justice system. I want to see racism and systemic racism specifically addressed at every single policy.
You nailed it, Robin. You nailed it.
Yeah, it's important for us at HUES Women's Health Advocacy Institute to continue these conversations about policy. And so someone put in the chat, we're looking forward to part 2. So there will be part 2. There will be part 3, 4, 5, and 6. Policy advocacy is one of the things that we do. It is a strategy of care for HUES Women's Health Advocacy Institute. And so we will be working on that and collaborating and engaging in conversation. I would like to just thank you all, each of you and our participants. There are always ways to stay in touch with HUES Women's Health Advocacy Institute. Subscribe to our YouTube channel. Make sure you follow us on Facebook and Instagram, and learn more at www.huesinstitute.org. Thanks, y'all.